afternoon and welcome back to our webinar on the changing COVID-19 pandemic. How are governments responding to variants of concern? Variants of concern are genetic variants of the coronavirus. They raise concern because they are either more transmissible or lead to greater infection severity or escape established immunity, or a combination of all of this. There are currently 4 variants of concerns listed in the European Center for Disease Control, and there's a long list of variants of interest and an even longer list of variants under monitoring. Clearly, the variants of concerns, the pandemic isn't over yet in Europe, not even in those countries making great progress with the rollout of the vaccination campaign. The COVID-19 pandemic is changing. And this raises the questions, how do governments, how do health systems react to the emergence of variants of concerns? Focusing on health systems resilience and building back better, we are particularly interested in the following aspects. What is the best approach to monitor variants of concerns so that we are aware of them from early on and understand their spread amongst the population, but also develop quickly an understanding of the dangers coming from them? What is the role of public health measures curbing infection rates with variants of concerns? How do we react as countries to the emergence of those variants? What are the public health and health systems measures? So my name is Matthias Wismar. I'm program manager with the European Observatory on Health Systems and Policies. I'm your facilitator today, and I will guide you through the program and the session. Our keynote speaker today is Richard Pebody from the WHO Regional Office for Europe. Richard leads the high threat pathogen team in Copenhagen. As spotlight speakers, we have lined up Michael Gharzouzi from the Ministry of Health in Austria. Michael is part of the Austrian Ministry of Health Corona Task Force. His main focus lies in virus variant surveillance and wastewater monitoring. He is, by training, a neuroscientist with an MD and a researcher at the Medical University of Vienna. And last but not least, Tyra Krause from the Statens Serum Institute in Denmark. Tyra is the vice president at interim at Statens Serum Institute in Copenhagen and fully engaged in the COVID-19 response. She is a specialist in public health medicine and has a PhD in epidemiology. Now, just a couple of things for the housekeeping. We have a very tight time budget, which is a challenge for all speakers, and we need to stick to it to allow for discussion at the end of the webinar. Just 3 things to remind you. Please send us your questions and comments through the chat box. My colleague Erika will feed back the chat to us towards the end of the session. We are also going to record the video, and we are planning to publish it later on our YouTube channel. Finally, we will send you an evaluation form, but we would kindly ask you to fill it in, as it is important to us for the next webinars. I'd also like to mention that we are very happy to resume our Tuesdays webinars after a break. As you may know, we started in October last year, and we have moved the focus a little bit from COVID-19 responses to build back better. This is because we cannot go back to the pre-pandemic old normal. We need to do better. We need to foster more resilient, more equitable, higher performing health systems. Please also go to our website and check out the upcoming webinars in this series. So before we start with the keynote, I've asked my colleague Erika Richardson to launch a poll on the topic. Erika, the floor is all yours.
Hello, everyone. Thank you very much, Matthias. So, Annalisa, if you could put the poll up on the screen. This is just something so we can get a bit of interaction going, and just to find out where you are in the audience. So first of all, just a quick question. Are you actually concerned about the COVID-19 variants that are popping up? But then a second question, to see if you are aware of any health interventions that are currently being used in your country in response to variants of concern. And that's a multiple choice question. So if it's all of the above or if it's everything, then please do let us know. That'd be really helpful. Thank you.
Erika, thank you so much for introducing the poll. And before we present the results of it, I would like to ask our keynote speaker, Richard Pebody, to give his presentation. Richard, the floor is all yours.
Thank you very much indeed for the opportunity to speak to you all today. So I'm going to walk you through the current situation regarding SARS-CoV-2 and in particular the issue of variants. So as you can see from this figure here, we remain in the midst of a global pandemic due to this novel coronavirus called SARS-CoV-2. So the whole world remains affected. We've had now to date more than 160 million cases and more than 3 million deaths reported through to WHO as of today. Now, one of the issues that has really kind of emerged more recently is the whole issue of SARS-CoV-2 variants.
Richard, your voice fluctuates a little bit.
And their public health implications.
Thanks.
So SARS-CoV-2, like influenza, is an RNA virus. These viruses have high mutation rates, most of which are harmless. However, occasionally mutations happen which change how SARS-CoV-2 viruses behave. And these particular variants, or these particular changes are called variants. Now, all the variants of concern involve genetic mutations coding for this part of the virus called the spike protein. And the spike protein is the part of the virus which is targeted by most of the currently approved vaccines or those in development. And these mutations really being very closely monitored by countries. Now, the reason why we're concerned regarding the variants is because of the potential changes which can happen in how these viruses actually behave. And so we need to undertake very rapid public health evaluations of these variants as and when we find them appearing. And these changes can affect the transmissibility. So some variants show ability to spread more easily from person to person. They can affect infection severity, with some variants resulting in more serious disease following infection. There can be an increased risk of reinfection, with some variants evading the immune system and leading to more easily to reinfections. There can be issues with diagnostic failure, where tests do not work as well. And finally, there can be problems with the vaccines, where vaccines don't work as well as they should. Now, what I would also like to highlight is the fact that for these virus variants, the mode of transmission of the virus hasn't changed. And the same preventive measures that we've been using to date, both in terms of public health measures, remain effective. Now, let me just walk you through the 4 variants of concern that have been detected and notified through to WHO to date. The first one to highlight is what's called B117. This variant was the variant first detected in the United Kingdom back in...
Your voice is still fluctuating a bit.
Back in autumn 2020. The second is the B1351. This variant was first identified in South Africa in the middle of last year. The third is the P1 variant, which was identified in Japan in travelers returning from South America, from Brazil, identified at the end of last year. And finally is the B1617, which is the variant first identified in India in autumn last year, and which has been associated with the increased in activity that's being seen in India and neighboring countries in recent weeks. Now, all these 4 variants have been associated with increased transmissibility, as you can see in the table here. In relation to the other characteristics, the picture's more mixed. The evidence base is still forming, but there's some suggestions, at least for some of these, that there can be impacts on diagnostics, and at least for some potential impacts in terms of possible reductions in effectiveness of vaccines. So these maps really just show the spread of these variants around the world now. And the bottom line message here is that many countries are detecting these three variants. In most instances, they were initially travel related, but at least for B117, this has now become one of the most common lineages detected across the European region. And if we look at the B1617, the variant first identified in India, which seems to be at least as transmissible as the B17, this has also been detected in many European countries now, and is also leading to local community transmission, at least in some places such as the UK. And this figure here just shows the range in prevalence that we're seeing for the different variants across the different European countries. It ranges a lot. So for B17, as I say, very high prevalence that's been observed in many countries. Less common detections for the other three, but in some countries the prevalence can be relatively high, as we see there for B1351 and for P1. What measures do we have to minimize the impact of these variants? So all countries in the European region have now started their national COVID-19 vaccine programs. And this remains and still remains a really important program to provide protection against severe disease for vulnerable groups, including variant strains. And we can see here the uptake in the priority groups. On the left, the uptake in the elderly over 60 years of age, and on the right, uptake in healthcare workers. And as you can see, uptake varies, but many countries now are reaching reasonable levels of uptake.
We can tell you to use the laptop for the.
So if we look at the lab confirmed cases and deaths by age in the WHO region, we can see that the proportion of deaths greater than 80-year-olds has been declining steadily since the start of 2021. This has been temporarily associated with a reduction in the age-specific case incidence in more than 80-year-olds since the start of 2021. But it's important to note that the median uptake of vaccine in the over 80-year-olds is now more than 70%. And this is associated with this reduction in case incidence in the over 80-year-olds, as you can see with the dark blue line here on the age.
Richard, sorry for interrupting, but it's very difficult to hear. Maybe you try without your headphones. They seem to be broken, something.
Okay, I'll try without. Hopefully that's better.
Yes.
Okay. So let's just move then to public health measures. So although vaccination remains a key intervention to reduce the impact of VOCs, the other key intervention is public health and social measures. What are they? So they include a range of measures, as you can see outlined here. They include individual measures, environmental measures, social and physical distancing measures, and international travel measures. How do they work? A comprehensive approach is necessary. This is shown by this Swiss cheese approach here. You need a series of measures in place to reduce the ability of the virus to spread from person to person. Why do we have them? Because of their ability to flatten the curve. And it's really critical that these measures are put in place to reduce the size of the peak and to flatten it out and to reduce the impact on the healthcare system. The challenge is that these measures will vary depending on the impact, the timing, the population that's being, at which they're directed at, and of course what viruses are circulating at that point in time. And if countries are seeing more transmissible viruses, such as with the variants, then these measures are likely to be needed earlier and potentially more extensively. So we can see here how countries have been implementing these different measures, how they have evolved over time. You can see that it is varied a lot by country. And as new variants have emerged and which are potentially more transmissible, it's important that countries tighten these measures as required, depending on what is circulating. We can see here by country what countries have been doing in terms of the dates of first detection of these different variants, and in relation to the level of implementation of these PHSM measures. The darker the blue, the more intensive the implementation of the measure. And what types of measures have countries generally employed? So many countries have initially employed travel restrictions to countries where VOCs have first emerged or where they may be spreading locally. So for example, with the emergence of B117, a number of European countries introduced travel restrictions to limit and try to reduce spread of B117. Other countries later, once the variants have started to circulate, have adjusted mask policies, for example. You can see examples there of different countries that have employed those measures. A third area which countries have undertaken in response to VOCs are the implementation of local restrictions when local transmission has happened. And again, several examples there of countries that have implemented those measures following local spread. But I think the key message here is that even in the context of the recent rollout of vaccination across many countries, as we saw, these comprehensive packages of public health measures really remain the most important tools that countries can use to suppress the spread of the VOCs. With that, I thank you for your attention.
Richard, thank you so much. I think that was an excellent presentation, and it made very clear actually that we still need to retain some of the public health measures or reintroduce them if necessary, if the variants of concerns are imposing this threat on us. And thank you so much for giving us really a very, very good overview. I apologize for the sound quality. We don't quite understand it because we tested it before the webinar. It went very well. And apparently, Richard, it's not your headset. It wasn't any better without the headset. So sorry about this. I hope you could still follow it. Now, Erica, can I ask you to come on board and present us the poll results?
Absolutely. So, probably unsurprising, seeing as you've all come to a seminar about, or webinar about variants of concern, you are all concerned about COVID-19 variants. I take that to be good news in a way, because we should be on top of these things. But there are two clear sets of interventions which are seem to be most commonly implemented for the countries represented in the audience today, and that's enhanced monitoring of cases, but also international travel restrictions. Those two seem to be the key areas that of the options given in the poll. So let's see how we're doing on those two things in our two spotlight countries. Thank you very much.
Thank you so much, Erica. And without further ado, I would like to give the floor to our colleague from Austria. Michael, please take the floor.
Hello again from Vienna. So I think Tyra from Denmark later is going to go a little bit more into depth about the databases and the transmission of correct information that we're obviously also doing. However, I'm going to go into detail when it comes to our variant surveillance. We've really been doing our best in that regard. I'll first just explain to you our general surveillance, then our Sentinel surveillance, which started more as a scientific project, and then I'll give you a few examples of how we're implementing this. Yeah, so how is Austria responding to the variants of concern? So as I said, first of all, we have our selective surveillance, which was completely state-run. It was an initiative from the ministry, where all positive samples that we get are transmitted for pre-screening. Pre-screening means that we're doing this via PCR, where we scan for specific mutations. This allows us to identify the VOCs, first of all, initiate appropriate measures, so the isolation of the concerned person, We also identified transmissional chains behind those clusters. So extensive contact tracing comes into play here. Has been really helpful for us. We're obviously keeping this up for as long as need be. And then also it allows us to assess the spread of the variants. So we are doing a lot of prognosis working, computational prognosis working, which allows us to sort of predict where clusters could emerge in succession to a previous cluster, to isolate that one appropriately, and yeah, just take all the measures that are needed in that regard. Then also, yeah, we initiate sequencing when it comes to those VOCs. I mentioned before that the pre-screening is done by a PCR. If there we find more than one mutation that points towards a VOC, this would not necessarily be something we have to do, because they can be identified just with the PCR tests, but still we try and sequence as many probes as we can, just to be absolutely sure. So furthermore, we have the Sentinel Surveillance, which started as a, as I said before, scientific project. So we have certain Sentinel laboratories and institutions that we work with that all volunteer to partake in this. And in this regard, we do randomized sampling of positive PCR results, and we do them via sequencing. This allows us to have an overview, as I said, randomized sampling, so randomized overview of the emergence of new variants that haven't been detected before. It acts as an early regional warning system, and all these results from the very beginning have been uploaded to GSET. So we've been sharing them with all other countries. And then last but not least, there's our wastewater monitoring program, which is something that now I think most European countries are going to do as well. Basically, what we've been doing is, you can see it on the map here, we've been monitoring regions that have more than 150,000 inhabitants. We monitor this with a frequency of twice a week. And not only for quantitative viral material, which was the initial plan, but we also sequenced that viral material in order to detect where new variants emerge in Austria. So it is the perfect early warning system. I'm not sure you can see my graph right now. No, it was there before. In case you can't, it just basically shows you the really strong correlation between what we've been getting from the wastewater monitoring in regard to patient probes. So it basically, the line would show you perfectly that it coincides with, maybe a week in difference, the wastewater probes and the patient probes. Perfect correlation. So it acts as an early warning system for us so that we can regionally detect the emergence of new VOCs or just variants in general. Oh, there we go. Now you actually see it. There, as you can see, the line, there's a pretty beautiful correlation there. And yeah, I was also asked to talk a little bit about Tyrol, which is our state of sorrow. I mean, we all love Tyrol, but it has been the state in Austria where most variants have been emerging. Yeah, due to its geographical situation, there's a variety of reasons here. In any case, I'm just real quick gonna present how we reacted to this. So obviously the measures that I mentioned before have been in place. Then also, as soon as we identified clusters, we first started with a narrow isolation, meaning on a community level or villages were isolated. People could only leave those with a negative test. Once we saw that the cluster was growing or spreading to other regions, we tried to widen the circle and do a broader isolation. Again, only with a negative test, you could leave these areas. And just to make sure that we monitor it correctly, the variant testing was upped another step. So we were doing it more extensively, and we were trying to vaccinate more extensively in those regions where the VOCs were present and popping up. And it's been working really fine. So controlling it, predicting it, that's basically what we're aiming for. And yeah, that's it from my side. Thanks for your attention.
Thank you, Michael. Thank you so much for filling us in on the situation in Austria. And I think there are a couple of things actually to take away. Number one, I think that you have really stepped up your monitoring efforts in Austria and using some newer methods, which probably will be used in the future again. And apparently, I mean, just like what Richard was presenting us, the linkage between the monitoring and then the public health measures. I think in the case of Tyrol, you made it very, very transparent, that this monitoring and surveillance is not just something you do for your own sake, but which has consequences actually, which really leads to public health action. Thank you so much. We'll come back later to you and probably Tyrol and Austria in general and wastewater, I guess. But now I would like to give Tyra the floor. Tyra, please.
So, and thanks a lot for inviting me for this webinar. I'm very happy to be able to present the experience we have had in Denmark with the surveillance of the different variants of concern and interest. So to start out, I think one of the backbones of our surveillance system is that we have built up an extensive test capacity in Denmark, and it's an extensive PCR test capacity. So there's free and easy access to antigen and PCR testing in Denmark. And we do regular testing in the healthcare sector, but also in schools and educational settings, and also at workplaces. We have just launched last month the Corona Passport, which is used for gatherings at restaurants or cinemas, or if you want to go to the library, then you can present a Corona Passport, and that's either if you've been fully vaccinated, then it gives you access, or if you have a negative test within 72 hours. Taken within the last 72 hours. And that's something that really supports also the testing, the ongoing testing in the population. And then all positive antigen tests, they are confirmed with a PCR test. They're recommended to get a second PCR test because we also see in Denmark a high proportion of false positive antigen tests. Almost 50% of those who test positive in an antigen test negative with a PCR. And that's because the prevalence is rather low now. But this is important because when we have a PCR test, then we also do this Delta, we call it Delta PCR, where we screen for certain variants or certain mutations. But we also do whole genomic sequencing, and we aim to do that for all positive PCR samples, or at least we have tried to since January. And this slide shows the proportion of positive, or the number of positive cases in Denmark throughout the whole epidemic. And then with the blue bar shows, and the blue and yellow bar shows the number of the proportion of these positive cases that have been sequenced, and those that where we have been able to obtain a full genome. And you can see it's quite a high proportion of all positive cases that we sequence now. And we have around, I think now we are around 900 or 1,000 cases a day. So we have in Denmark a lot of national healthcare databases, and our surveillance system is built on electronic data capture from these databases. So the core of our surveillance system is a microbiology database that contains all microbiological test results, both positive and negatives. And of course, from this, we can extract all the COVID-19 PCR test results, but also the antigen tests. And we can link this information with the unique personal identifier, also with the data on variants, different SARS coronavirus variants, and whole genomic sequencing data. We can also link to a national patient register to find out whether people have been hospitalized and whether they've received intensive care unit treatment, or whether they have underlying diagnosis. And in that way, we can see whether certain variants are associated with a more severe outcome. We can also link with the civil registration system to see whether people die, but we can also see whether they live in households. And if they live in households with more family members, we can look at attack rates within that household. And in that way, we can assess the differences in transmissibility between the different variants of concern. Then we have a national vaccination register. And in this way, we can also follow vaccine failures also by the different variants to see whether we should have a higher proportion of vaccine failures among certain variants. We also have information on whether people live in certain settings, like in nursing homes. We also know whether children are connected to schools, and we also have information on occupation for the whole population. So we can also look into outbreaks at workplaces, at nursing homes, and at schools. So by linking all this information for these variants, we can assess severity, we can assess transmissibility, and also assess immune escape. We can also look at reinfections, and because we have had a very high whole genomic sequencing capacity for a long time, it is possible to go back and see whether people have been reinfected with a new variant. So we have used this whole genomic sequencing for a lot of different things during the pandemic. We've been studying transmission chains, and we had this, we could use it to study this transmission of COVID-19 from humans to mink and back to humans. And we could also assess the public health risk associated with mink farming. There's a very high occupational risk connected to that. We have also been able to identify outbreaks and to study outbreaks in more detail in order to learn from them. Recently, we had an outbreak of this new Mexican variant at a restaurant, and we could find out how actually the virus came into the restaurant from a traveler that had contact to a person working in the restaurant. And we had more than 50 cases connected to this outbreak. Then we've done extensive contact tracing around cases with the variants of concern and variants of interest. We have dedicated contact tracing teams, and they do intensified contact tracing where they identify close contacts, but also close contacts to close contacts that have to be tested and maintain in isolation until they have a negative test. And they also do regular isolation checkup calls on those with specific variants. Then we have used it for modeling. So already you can see on the picture or the graph that the development of B117 from January until April. And already in the beginning of January, we did these projections and could see that B117 would become dominant by mid-February, and we could plan for that. So we maintained the lockdown for a longer period than we would have otherwise, in order to get case numbers down before we could expect this variant to be dominant. So this was a brief overview about what we are doing in Denmark. Thank you so much for listening.
Thank you so much. That was very, very impressive, honestly. And I take three things from your presentation. Number one, you need to have capacity. And I think you made it very clear that the PCR capacity was in the beginning quite important. And as far as I remember, in the beginning, many member states in Europe didn't have that capacity. Actually, they were not sequencing as many samples as you did in Denmark. And the second thing, and I think that's very impressive, is the integration. You know, how do you integrate all the data from the vaccine to the hospital to the variants? I was just listening today in the morning on a radio program on Germany, and Germany will probably miss the boat for the European vaccination passport because they don't have the data on the vaccine available in digital form, apparently, at least some of the states. And you have it everything, and you bring it together, and you can draw conclusions from it. And that's the third point. You know, on your last slide, you show that again, this is not just monitoring and thinking about whether something bad is going to be, but you're really reacting to it, and it has impact on public health measures. So thank you so much. That was a great presentation. Thank you to all the presenters. I think I've got a really good overview now on the variance of concern. And while I'm still concerned, I'm not panicking, of course. And I think it was very interesting. So, Erika, that is now time to have a look into the chat box and to ask all our speakers, to join with a video for some rounds of discussion, please. Erika.
Okay, people have been very shy in the chat box, and that's absolutely fine. You don't have to make it visible to everyone. You can send your questions to just the panel if you would like. So please do feel free to ask questions in the chat box. And but to start off with, just a couple of little things. I suppose the big question is, and it's a question for all of you, but especially for Richard, is how worried should we be about variants of concern? And is this something we'll be able to vaccinate our way out of in Europe? Or do we really need to be looking at the global solidarity around vaccinations? A question for Michael. What resources are needed for wastewater monitoring? What sort of things need to be in place? Is it something that's relatively easy to do, or is it something that you need really good data systems for, things like that? Because it looks like something that could be a really good early warning system for countries. And then given the amazing linked up data that you have in Denmark, have you seen any patterns in Denmark that we should be very scared about? So have you seen anything about variants which have a particularly high level of lethality, or evade vaccines, or are more likely to cause reinfections and things like this? So is there anything you've seen from the Danish data that we should really be looking out for? But just a little round to start with.
Yeah. So Richard, please, the variants of concerns, are they of very serious concerns, or just a little hiccup while the pandemic is phasing out?
Thanks, Matthias. I guess the answers in the definition, the variant of concern. So I think we do need to take them seriously. I mean, as we saw, we are still in the midst of a global pandemic, but we're not at the end of it. And these variants do potentially have different characteristics, as we saw, in terms of their ability to spread, their severity, potentially their ability to not be as well covered by the current generation of vaccines. So we do need to take them seriously. But we do have measures in our toolkits to be able to detect them, to be able to assess them, and to be able to respond to them. And I think we saw that very nicely in the presentations just now, that that we can deal with each of those areas. There are things that we can all do.
Great, thank you so much, Richard. But still, of course, for the public communication, there is an area of uncertainty which we need to deal with, and we need to be aware of it. That's great. Michael, the wastewater monitoring and the resources it takes. Maybe we can expand the question actually a little bit, because you've been presenting both Tyra and Michael great examples. But the question to me is, now everybody is throwing money at the pandemic, but after the pandemic, will there be some sort of sustainability for this sort of monitoring and surveillance, or will this all be rolled back again? Please, Michael.
Yeah, well, Matthias, you said it beautifully. This is, I earlier called it an early warning system, but more importantly, it'll be something that will still be in place once the pandemic dies down and people do not go to test as frequently. This will still allow to monitor on a national level if the virus is still present, where it's present, what demographics it concerns, and obviously if new mutations emerge. So that is the main idea of it. Yeah, and to still answer I don't know what somebody asked that question before. All you need, it's basically very simple, because most countries have treatment plants, wastewater treatment plants. So all you need is a wastewater treatment plant. Take a sample from there, like we do it with basically 0.5 liter. So not like you need huge amounts. You just take the sample, you take it to a laboratory. So the logistical implementations have to be cared for. And once it's taken there, well, all that is left to do is to centralize all the information. So have a central base, basically, or some sort of dashboard where all the information gets collected, and then ideally transmitted to other countries or on an EU level, which is planned in our case. So it's something that really isn't difficult to implement, and it's very useful, as you can see. It's something that hopefully will be up for the years to come, just allowing us to monitor this closely.
So you say it's almost integrated into the routine monitoring of wastewater, exactly. And there's not that much of additional resources necessary to at least take the samples, and of course then they need to be processed. Thank you, Michael. Tyra, I think, Erica, can you repeat the question? You got it, Tyra, yes.
So,
yeah, I think
yes,
I can
given all the
remember
data you've got available, what have you seen anything we should be concerned about?
Yeah, the thing is that we have mostly started B117, and that's because we have had so many cases of B117. Of course, now it's dominant. But what we have been looking into household transmission patterns of B117, and as in the UK, we've also seen this approximately 50% higher attack rate in households. But we've also been able to look at the attack rates by age, or the transmission risk by age, and we have done that for the normal variants, where we see a U shape, so that the transmission risk is higher when you are a very young child below 10 years, but also if you are old. And this pattern is even more pronounced with B117. So you have an even higher risk of transmitting the virus if you're a child and if you're older. That's been one example. Then we have also been seen that there's an increased risk associated with hospitalization for B117 compared with the other variants of about 40% increased risk. So that's one example. We are following vaccine failures for the other variants, but we cannot say that we see some patterns that, but we also have very few cases of B1351 and also P1, and we're looking more into the Mexican variant now. So yeah. No really other alarms from Denmark on that, on other variants. And then regarding the sustainability of our system, of course, we have to also scale down our test capacity. We test almost 5 million people every week now. That's 70% of the population, and we cannot maintain that. So we are also now starting to do wastewater monitoring, and then the idea is that we will be able to react locally on signals with pop-up test facilities, and maybe also home testing, home PCR testing, as you also do in Austria. So that's what we are exploring now. And then we have to have some kind of Sentinel surveillance at schools, we expect this autumn, because that's where we expect transmission to occur, even if we vaccinate, have a vaccination program.
Thank you so much, Tyra. Erica, any other question coming through?
Yes, a kind of slightly technical one again for Tyra, but I think this probably applies more widely. Who should be responsible for collecting together all these different data sources? And how do we get around privacy issues? And I think that's, that was a question specifically for Tyra, but I think this is something that could be answered more broadly as it applies more widely. And then, Maybe and so I suppose this is my question. If you were going to be not just advising governments, but you're actually in power and you could do stuff, what would you do? What would you do? What would be your absolute #1 priority when it comes to variants of concern? That's my question.
Maybe I can expand this a little bit for Richard. Richard, I mean, in your position, you see a lot of countries, and what they do with regards to the monitoring, but also to linking monitoring to public health action. Do you feel that in Europe there's a model emerging, or that there are clear elements what should be done? That's what Erika was asking, just a little bit broader. Maybe we start with you, Richard.
Yeah, no, of course. Clearly, I mean, capacities across the region vary considerably in terms of surveillance systems. But I think it's important to bear in mind those three different elements of being able to pick up signals early. So for the presence of circulation of a variant of concern, to be able to then evaluate it and to be able to respond. And I think we would want each country to at least be able to pick up signals at a relatively early stage, and countries will do that in different ways, and it may be that some need a little bit of support in being able to do that. We heard from Tyra, obviously the Danish model, which is very strong and illustrates really, I think, the sort of model that we really want every country to do, but perhaps it's not realistic for, you know, some of the countries in the region to sort of have that level of surveillance in place. But that's, I think, the type of thing we should be aspiring to in terms of risk assessment and risk detection. In terms of risk management, I think that's also an area which is also really important actually for all countries as well. Because if we don't take these variants seriously and manage them accordingly, then the risk is that we end up with very intense levels of community transmission, health systems become overwhelmed, and we really see big increases in impact on the health of the population. And that's obviously what we want to try and avoid. And I think if we bear in mind the measures that countries can implement, and if they implement those at an early stage, we can flatten the curve and avoid that type of scenario.
Thank you so much, Richard. Tyra.
Yes, if I answer the first question first regarding GDPR and who's responsible for linking the Danish data. Our institute, we have a mandate for doing surveillance of infectious diseases and also do risk assessments. And we are allowed to link all these data, and we have access to these data. And so we are not so challenged because we have this as our main task, but it has been very challenging to share the data, for instance, with researchers. And I mean, we haven't had all the resources we would like to do all the research and all the studies that would be relevant to do. And that has been quite difficult for us to share the information with other institutes or universities for research. I think, and we've also had, as some of you may have noticed, we've not been able to upload to GSAID for a long time because it was discussed that it was the lawyers, they evaluated that it's personal identifiable information when you have a special variant, because you can actually know exactly who it is because it's a very specific variant. And we've been struggling a lot with that, and we had needed to have some special legislation to be able to upload data for GSAID. So that's some of the problems that we've had.
Tyra, could you briefly say what GSAID is?
That's this international database where we upload all sequencing, and that's both for SARS coronavirus, but also for influenza viruses, in order to be able to share between countries, and we can follow the development in other countries. And also for WHO, I guess, to follow the development, the viral evolution of the variants.
Thank you so much. Michael.
Sorry, I was muted. If I'm not mistaken, there was no direct question addressed to me. I guess the one I would be interested in answering is, which was a funny one, is if I had the choice to implement measures, or, you know, however it was phrased exactly, I guess what I'm seeing now, what I'm observing here in Vienna as well, is that a lot of people forget the common good when it comes to variants. So if they had a previous infection or if they're vaccinated, they sort of become a lot more careless. So my initiative would be to inform people to still think about others. And even if they, you know, a lot of people that contract new variants now are asymptomatic. So they're like, even if I get it, who cares? Well, I guess it's to not forget the common good. that's what I would like to convey to people.
Erica, anything else coming through the chat box?
Yes, more technical questions on data sharing. Okay, so sorry. Oh gosh, things are going backwards and forwards in the box. Okay, so if Denmark was to, this is a question for Tyra, if Denmark was to scale back rapid antigen testing as a part of with the introduction of wastewater testing, how would it affect the Danish strategy of opening businesses and services to customers based on based on rapid antigen testing results? So slightly off. But
maybe
yeah.
Tyra, just before you start, maybe I can add a question for Richard, actually, because Richard, I mean, you are responsible, so to say, for the WHO European region, which is a very diverse region, and in the EU they have the ECDC, which is collecting information and trying to spread. And we all know that the virus is not respecting borders, and we have very close relations between countries here. Where do you see the role of WHO, bring together the entirety of the region and to make sure that also these countries, which are less affluent than the EU member states, are really helped and understand, have monitored the variants of concern. But first, Tyra, please.
Yes. Yeah, we have this Corona Pass I talked about, where there are 3 components. You can be vaccinated to have a green pass. You can be fully vaccinated. You can have had a previous infection within the last 8 months, or you can have a negative antigen or PCR test. And this has been a very important, and we've used all these different databases in order to make this pass that is electronic, that you can have it on your iPhone. And the idea is that this will be phased out by August, I think, because then we will have people most of the population fully vaccinated, and then you don't need this pass anymore, and then you don't need antigen testing to the extent that we have now. So, and that's where we are going to, for autumn, really use wastewater monitoring instead, and then scale up the PCR capacity only where it's needed. So we will not have this population access to PCR testing, but only for those who have symptoms, and maybe we'll have some Sentinel systems where people can use home testing that can be sent for our institute or collected somehow. That's what we are working on to set up.
Let's cross finger that this is a prediction that will fulfill. Richard, please.
Yeah, no, sure. So thanks, Matthias. I mean, from WHO Euro perspective, I mean, we work very closely with ECDC and on different areas, and serving obviously the 52 member states. And I think for the non-EU EEA countries, that's obviously also a very diverse group of countries in terms of their needs. So we've been looking very carefully and working to support those countries that need it in terms of the different areas. So on the surveillance side, for example, that might relate to helping to build laboratory capacity. So for example, the use of what are called SNP assays, which are these pre-screening assays to try and detect circulation of certain mutations in the viruses that are circulating in the country, or providing reference laboratory services for samples to be referred for sequencing. So providing support on the surveillance side, whether that might relate to surveillance strengthening. And obviously on the reporting side, we have a sort of common database that's used for all the member states across the region, which is called TESI, which is this European surveillance system, which we work with ECDC on, and all countries report into that, and we use that as a way of seeing what's going on across the whole of the region. And then I encourage people to look at, there's a joint weekly bulletin that's produced by ourselves and ECDC that's published each Friday, which provides a summary, a snapshot of what's been going on across the countries of the region, including on the variant side as well. then finally, there's obviously the issues around the risk management side of things. And so we very much try to sort of provide support for those countries who need it in terms of, for example, strengthening contact tracing services or providing support on assessment of whether there's needs to strengthen public health measures. So yeah, so it's very much has to adapt our kind of support according to the local need.
Thank you so much, Michael. You want to add something to it? Otherwise, I would ask Richard just for a couple of final remarks before we close. Michael?
Yes. No, please, Richard, you go.
Richard, please wrap up with me this session.
Okay. So yeah, I mean, just to say a very big thank you to the speakers. I think what we've heard in the past hour is that, you know, variants of concern are and will continue to be an important issue for us all. We need to ensure, and we've seen how the importance of strong surveillance systems with both virological and epidemiological elements to them to be able to detect these variants at an early stage and to be able to assess them as well in terms of their characteristics. And we've seen what those different elements of a surveillance system can be from the presentations from both Austria and Denmark. But then I think we've also heard as well the real importance of what we then do about those variants in terms of those public health measures. Whether those are contact tracing, whether those relate to travel restrictions, and of course, underpinning it all is the real importance of the vaccine programs and ensuring that those continue to roll out really, because those do remain really key to protect those vulnerable groups.
Richard, thank you so much. I was among the 100% of people who were concerned about the variants of concern. I'm still concerned, but I'm a little less concerned because I think we have the monitoring tools and we have the public health measures. But what still concerns me is the solidarity across the whole European region, because, you know, the countries outside the European Union, the less affluent countries, you know, the countries with less developed infrastructure, I think they are struggling harder. And the vaccine campaign hasn't really picked up speed as much in some of those countries as in Europe. So I think we will probably continue to think about, you know, how to strengthen these countries in their response. Thank you so much to all the speakers. Thank you so much to all the attendees and for all the questions. It was a great pleasure. And please tune in next Tuesday at 12 o'clock. We will talk about informal carers in COVID-19 and what we can learn for care integration. Bye-bye. Take care.